Thank you. Botox, it's usually injected into the face to improve the appearance of wrinkles. Now, though, it's being used to relieve jaw pain and headaches. As we all know, some people get Botox to smooth out the wrinkles and to look younger. Now others are finding it actually helps relieve the pain they've gone through for years. Dr. Bruce is here now to explain. Bruce.
That's right, Colleen. TMJ. Millions of people suffer from it. Headaches, jaw pain, teeth grinding, the lower teeth getting smaller and dangerous. And they use mouth guards. Few options. Sometimes they need surgery. But now there's something completely unique, Botox.
My boyfriend, the whole boyfriend situation, he used to think that I was taking a water bottle and just crushing it all night long. But then he realized one night that it was just my jaw just grinding on itself, cracking in and out of place.
In the mornings, I get headaches a lot. So I tend to get a lot of tension in my jaw, and it kind of shoots up into my head, and I get these really severe tension headaches.
Elsie Chang and Megan Granger are describing TMJ syndrome, something they can't control. They're not even conscious of it when they do it. Teeth clenching, grinding, much of it at night in their sleep. They tried wearing mouth guards, but they grind the mouth guards down in weeks, and it would cause all sorts of symptoms.
They had recommended doing some kind of surgical procedure where they essentially go in there, kind of shave it down and realign it somehow, but I was opposed to that because it sounds pretty invasive.
Many people do get surgery for TMJ, but Dr. Alexander Rivkin had a new idea. He started using Botox to treat his patients with TMJ.
So the only way to solve that problem is to weaken the muscle that's actually spasming. And I had heard in Asia that they would do this kind of thing in Korea, where they would put Botox into the masseter to reduce the masseter muscle. And I kind of thought, well, that should work for grinding. That should stop their teeth grinding as well.
Elsie underwent the procedure recently.
Relax. We're going to do 20 units.
Rivkin numbed the area with ice. He then injected Elsie's masseter muscle with Botox a few times on each side. It took just about 15 minutes.
You should start feeling an effect within a few days.
Megan had the procedure 8 months ago.
Within 3 days, it was, I was not grinding my teeth at night. Just the tension just was gone from it. Even in the day, it just felt like a totally different face.
Now, the procedure costs $500 to $700, but get this, it may sometimes be covered by insurance if you can't afford it. Sometimes the maker helps pay for it too because it's being looked into. It needs more study. Now, some people, the doc says, need the treatment just a few times. You break the cycle, and it may get rid of grinding permanently, but some may need to come back for periodic treatments. We'll need more studies to figure that out just exactly. But it's the answer for people that are failing everywhere else. Colleen, it sounds like you've had it a little bit yourself.
Yes, I'm looking at this. I'm looking at the story you're doing, thinking this may be the answer.
Yeah, safe answer too. Despite what you've heard about Botox, in the right hands, it's completely safe. Good news.
Okay, thanks very much, Bruce. And now let's talk about sugar, because if you're eating a lot of sugary foods and drinks, then